Hello, I'm Sarah Day, Policy and Research Manager at HFMA, and you're listening to HFMA Talk, the podcast for NHS Finance. The HFMA is here to support our members, the wider finance community and the NHS throughout the coronavirus outbreak. Part of our role at the HFMA is to support people to feel less isolated in their work and decision making at this time by sharing learning and experience from other areas. It is our intention to produce a range of podcasts that will hear from people working across different sectors, regions and roles. Sharing personal experiences of the pandemic and highlighting areas of learning so far can be very helpful for us all. In this episode, we hear from Caroline Clarke. Caroline is the Group Chief Executive of the Royal Free London NHS Foundation Trust and the current HFMA President. Based in North London, Caroline shares her learning from her trust and offers some insights into how others can prepare for Covid-19. Hello Caroline, thank you for taking time to talk to us today.
That's all right. Hello.
Hi. I wonder if you could start by telling us a bit about the Royal Free and how Covid-19 is impacting you.
Okay, so the Royal Free is a group of hospitals in North London, 3 main hospitals, and then we serve a wider area. And the main hospital, the Royal Free in Hampstead, is people will have heard of it because we used to look after the health workers coming back from West Africa who had Ebola. So we had a high-level infectious disease unit and have had it for years. And of course, that gave us kind of infrastructure and a capability to look after patients who are very infectious. And so we took some of the earliest patients with COVID-19 and have been seeing. So in a sense, we've been sort of on this road for quite a long time. We've got another hospital, Barnet General, which is in North London and has a very frail older population. And so they are experiencing a slightly different wave of patients coming to them with slightly different symptoms. And then we've got another hospital, which is an elective hospital called Chase Farm, which we're using as a kind of step down. So I've got 3 hospitals. We've got 10,000 staff. And we work as a system in North London, so UCLH, the Whittington, the North Middlesex and the Mental Health Trust. And we're working as a system now in a way that we never had before. So actually out of a crisis, some amazing stuff has happened. So I suppose the big thing for me is we have been at this for quite a long time. So there may be some learning that we should get out in this podcast. And we're seeing quite different things in different hospitals. So depending on the populations that you serve, you know, the sort of the response to the hospital needs to be different. Not all the hospitals are the same. So it's been... I'm quite tired, actually. So what's the date today? It's March the 26th or 27th, isn't it? And I feel like I've been at this for quite a long time, as have quite a lot of my team. And quite a lot of my team now are not feeling very well and have had to self-isolate. So, you know, it's a big lesson for me in kind of resilience, both personal resilience, but also in making sure that you have like really good business continuity plans and all that stuff. So big bit of learning. So the first thing, I guess, is you've got to realise that you've got to kind of think through what your hospitals or community organisations or mental health organisations are going to kind of look like over the next kind of weeks and months. And you've got to have quite a clear view of how your system is going to operate and which are going to be the main hospitals and which hospitals might just receive and then transfer. So in London, so this week in London, we announced the opening of the Nightingale Hospital, which is a potentially 4,000-bedded hospital in the Excel Conference Centre, which will receive the patients who need ventilation in London who can't be treated in our hospitals because we just run out of space or we run out of staff. And so you've got to kind of think as a system how you're going to work and what the models of care are going to be, and then you need to arrange your own organisation to suit that. So we have so in order to do that, most places that I know are running their organisations like sort of in a major incident form. So you know we have a gold command that meets every day and has a very, very quick rhythm of change. But as everyone keeps saying, it's a marathon, not a sprint. So whilst you've got a gold command and things are quite urgent while you're in that kind of setup phase, you also need people who are quite good at programming and sort of program management to help you think through what the kind of milestones in your journey are going to be, and to have one eye on how you're going to recover. That's really, really important. And I can come back to that actually, and just kind of have, my board's been very helpful in helping us think that stuff through. So we got a goal command, and anyone who's worked in a major incident before will know that with a goal command, there are quite formal ways of keeping track of what's going on, and logists and actions, and quite a fast rhythm, and everything is much more directive. It's we're working in a way that many of us haven't worked before, because actually most of the NHS has worked on kind of consensus and sort of liberal consensus at that, and now it's much more directive. People talk about the Civil Contingencies Act, and that actually often we just have to do stuff even when we don't like it, and I'll come back to that, because that's very, very difficult for some of our clinical teams who are being really, really stretched and asked to work in a way that their training has never prepared them for. So our ITU nurses, who are used to working kind of one-to-one with a patient, are potentially going to have to work 1-to-6. That's mind-blowing if you're an ITU nurse, and the same for the doctors. And they'll be working with kind of people with different skills. So some of that stuff is totally mind-blowing for our colleagues, and we have to respect that. That's been quite difficult, I think. One of the other things that's changing in my organisation actually is what the board does. And so we've had so I've got this gold command, which one of my most experienced, each of my sites has got a chief exec, and one of my most experienced chief execs is running gold command. And then I have a kind of weekly executive committee that takes a slightly longer view, so isn't just thinking about what's happening tomorrow and the next day, but is thinking about the next couple of weeks and what the systemic response should be. And then the board is thinking around, very, very clear about business continuity. So we had a virtual board meeting last week, and we're using MS Teams, and most of us are kind of definitely over 40. Quite a lot of us are over 50. So using MS Teams has been quite challenging, and I think we're getting used to it now. But it's and I think it's a really good way of working. So this digital virtual working, I hope we keep that a lot. But anyway, so we had this board meeting last week, and we talked a lot about business continuity, and that's things like everyone's got to have deputies and deputies of deputies, because you just don't know who's going to go down. You've got to have policies around separation and rotation and annual leave, and you've got to make sure that people take leave. One of my biggest jobs has just been really requesting my colleagues just to take the odd day off here and there, just to kind of sort of regather their strength and so on. So, for example, I'm working at home today just because I just needed a bit of a break. So we're thinking a lot about the role of the board. We've got our non-execs buddying our execs, focusing on kind of support and resilience, which is really helpful. The board's also very focused on kind of staff safety. So how do we make sure that we minimise healthcare worker transmission? How do we make sure we're following Public Health England guidance, but also that we're just taking appropriate care for our staff? And then there's a massive effort around staff welfare. So meeting both the sort of practical and the psychological needs of our staff. So, we've got a brilliant charity, and I'm sure lots and lots of other hospitals will be kind of seeing a wave of support for the NHS. So we're recording this the day after the NHS clap last night, and I missed that because I was down at the Nightingale Hospital. But I got home and all my neighbours had sent me little films of everybody clapping in the street. It was very, very moving. So anyway, so big emphasis on the board. So I'm just thinking through again kind of the board role. So my board very focused on staff welfare, and making sure that we have both physical support and psychological support. So we've got an awful lot of psychologists and psychiatrists in our trust, and we've got a fantastic local mental health trust. So galvanising all that and making sure that we can send support to the staff who need it, because our staff are going to see some stuff that they're going to have a level of underlying anxiety because we're asking them to work at a level that they haven't been trained for. Many of our staff are going to have to deal with many more patient deaths than any of them had ever contemplated, and you have to provide a level of psychological support and safety for people in that circumstance. So that's a really, really big deal, and one that our board is very, very focused on.
I was going to ask how you're looking after your personal resilience at the same time as thinking about all of the staff that are working in your trust.
Yeah, so, well, I'm at home today, so that's part of it. And of course, I feel, it's interesting. I feel slightly lucky to be going to work, in a sense. I'm very privileged. That real sense of kind of honour to be doing this. So it doesn't feel like a chore. It feels like something that we step up to. I see my clinical colleagues doing this amazing stuff. And it gives you, you feel quite good about it. So there's that is worth saying. And I think my exec colleagues would all say the same stuff. And then, like I'm going out for a run or I'm cycling and I'm doing, the physical thing. You've got to do stuff that isn't in your head just to stop angsting. But you also got to accept that you do wake up at 4 o'clock in the morning worrying about stuff, and it gets easier. So the thing that I've really observed is that we've had probably 4 or 5 weeks of kind of relentless system set up, getting our processes straight, just making everything a bit more systematic, and it's calmed down slightly now. So I'm having kind of less 4 a.m. worries, and I'm sleeping a bit better, and I have never stopped eating because I'm essentially quite greedy, and my colleagues and I feed each other and we look after each other, and we're all practicing kind of sort of mindfulness and stuff. So and I've practiced mindfulness for years, actually, so that's kind of part of my kind of general kind of resilience. And if people are interested in that, then there are really good apps. There's one called Headspace. Other apps are available, but I couldn't recommend that enough, actually. So exercise, eating, mindfulness, and talking about this stuff. You've got to talk about it. This isn't a time for heroics, and it's not a time for kind of sort of bravery in the kind of Churchillian sense, but it is a time for people stepping up, and it is a time for people taking care of each other and looking out for each other, and I've seen so much of that, and it's been amazing. And I'm gonna talk about my chief finance officer, Peter Ridley, now, and he'll be really embarrassed about me saying this, but he has just been absolutely amazing. He's stepped into a role that wasn't there, that he just took responsibility for logistics. He took responsibility for making sure our staff have PPE. He's taken responsibility for, actually, we've become a supply hub for our local system now. And he's just really stepped up and into a role. And, I think if there's anyone here wondering about the role of anybody in finance or any associated profession, if there's something that needs doing, just go and do it. And remember that you're part of a team, and, those at times of great stress, the relationship is more important than the transaction. It's all about, if you say you're going to do something, do it so people trust you. If you're not sure about something, ask. And this stuff kind of makes great teams. So I've been so impressed with not just Peter, but his whole team. They've just been amazing. So I sort of, sorry, Peter, if you're listening. Probably doesn't. So, but I think there's something. The other thing for me that's really difficult, and I wonder if other people recognise this, is how you provide visible leadership when you're supposed to be physically distant. So how do you reassure staff that you're with them, that you're absolutely on their side, that you've got their back? That phrase I use quite a lot, and I say to people, you're going to be making decisions now that you may find very difficult to live with, and things that you wouldn't have done in a normal kind of non-pandemic time. But I want you to know that we've got your back, and we will cover you. It's that sort of thing. So and it is a time for great rule breaking. So I've seen Peter and I have spent the last 4 weeks just breaking every rule that we ever knew we had. But it doesn't mean we've lost control. It doesn't mean we haven't got good governance. We've repurposed our finance committee, which is non-exec led, to make sure that we report everything there, and to make sure that we have a new set of delegated limits and all that stuff to make us much more flexible in our decision making. But we've cut through loads of bureaucracy, and it's just been joyous. So there is something for me around preserving some of this the flexibility and the sort of anti-bureaucracy that we're experiencing at the moment when we come out of this. And I do think that we will come out a stronger organisation, a stronger team, and that's really important. I haven't got an answer to visible leadership, except I'm doing a lot of stuff digitally and making a lot of films, and I'm trying to kind of rotate my senior leaders so that we're all kind of around, but not all the time, and we're not all together, so that if one of us is unwell, we don't infect the others. So there's all that sort of thing you have to think about. That's quite difficult.
So are people picking up different roles? I mean, are the finance team getting involved in other things in the organisation that they wouldn't ordinarily have been doing?
Yeah, so certainly, so I've done my kind of my homage to Peter Ridley, the CFO, but actually his whole team are stepping up. So lots and lots of involvement in logistics and just moving supplies around, and facilities management, making sure that we can feed our staff, we can transport them, that things are cleaned. We sent out a survey to staff quite early on. I mean, it was probably only about 2 weeks ago. It feels like 2 years ago, where we asked people what their skills were and whether they'd be willing to work in other areas. And the finance team responded brilliantly. So there are plenty of people doing stuff differently. But of course, we actually still need to pay people. We still need to pay our suppliers quickly, particularly small suppliers who'd be really anxious at the moment. So we've been very, very overt about some of the things that we're going to preserve. And of course, we've got to pay our staff. We'd like to pay our staff earlier, because some members of staff, particularly where they've got partners who are not able to earn during this period, their families will really suffer. So we're really thinking about how we maintain cash flow kind of in society, because as a big public body we have a kind of moral duty, if you like. So thinking quite hard about that. And so lots of and I think it's quite difficult to imagine kind of where everybody is gonna if you've spent 6 weeks, 12 weeks doing different job, kind of imagining yourself back in the new job. So part of my job and Peter's job, I think now, is to help people reimagine their future, reimagine what the organisation will be, with much quicker decision making and people being much more aware of the organisation and a less distant finance department. So I think some good will come out of this, as well as an awful lot of anxiety and sadness. There's some more stuff I want to say actually about my organisation, and about how even when you're being very reactive, you can still learn about stuff, and in a sense, us sharing what we've done is really important, but we're learning. Each of my sites is doing certain things a bit more quickly than the other one, so they kind of learn from each other, and it is a kind of it's a real time for experimentation. People are, it's such a desperate situation, so making sure that we participate in clinical trials, that's really important, and some of my finance colleagues have been quite helpful in terms of setting that stuff up. Making sure that, in fact, so Project Nightingale, this thing at the Excel Centre, 4 or 5 of my very senior leadership group are intimately involved in it. But I've got a medical director down there, one of my chief execs, my estates director, and now my quality director are all basically seconded to that project to set it up, because we built a new hospital 2 years ago called Chase Farm, and it's tiny compared to Project Nightingale, right? You could get 4 or 5 Chase Farms into this, but we are one of the only teams that built a hospital recently, and probably one of the only ones in London. So we've sort of taken that team and kind of donated them to Project Nightingale. There's something for me about, during this period, other stuff will happen. So in our world of kind of finance and governance, we have to remember that actually the level of risk around cyber attacks has gone up, because people will use this period, unbelievable though it is, people will use this period to launch more attacks. So we've seen more attacks on our systems, and I think last week there was a raised national level on cyber. So you have to make sure that all your systems are really resilient. And again, to make sure that you've got some governance around that, so people are checking it. And then, of course, other things are going to carry on. Like women are still going to have babies. People still have cancer. People still have heart attacks. Although we're noticing there are less heart attacks in our organisation, weirdly. But that means that you have to keep some of your NHS services on the road. You can't afford to just be 100% on COVID-19, and you have to think about how you're going to preserve parts of your system. It's the thing I was saying earlier, actually, about how is your system going to work. And effectively, we've now preserved one hospital in our system to do essentially cancer work, some kind of vascular work, and other sort of bits of major surgery that's unavoidable. So that's important. And actually, there's a big deal the government signed this week with the private sector, which I think initially might help that too. So you've got to try and preserve curative and life-saving surgery as much as you can. But alongside that, you also have to develop a kind of ethical framework to help clinicians make decisions quickly about which patients we need to treat and effectively help them prioritise. We've been very clear that frontline clinicians should be preserved from that, and that we try and have a kind of a framework across North London that basically responds to the amount of capacity we have in the system. By which I mean, have we got staff available to do an operation or to provide services for you as a patient if you're COVID positive, so there's a set of ethical principles, and they're kind of enacted at a senior level. So my medical directors are responsible for that, rather than kind of jobbing doctors and nurses. That stuff's really, really difficult, because of course we've had a universal healthcare system, and although we do ration through waiting lists, actually generally, if you have a life-threatening condition, we will do our best to cure you. And that contract with the public has existed since 1948, and that is the contract that people are really scared about breaking at the moment. And that's the really difficult thing, and that's the reason why you need to provide psychological support for your colleagues, and as well as all the kind of sort of pay and ration stuff. So that's incredibly important, and really I've seen some of the greatest minds in medicine kind of really think this stuff through recently. It's been extraordinarily humbling to be part of those kind of decision-making processes. But again, our jobs as leaders is to, and actually as finance professionals, is to provide data to make sure people can see what's happening, and to make sure that people have data to support decision-making. I think that's really, really important. And actually it's the... can you, again, this piece around, can you look to your organisation sort of a couple of weeks out and think about kind of patient numbers and help the clinical decision makers think into the future? That's a really good role for finance professionals, I think.
Is there anything that you wish you'd done a bit earlier that would have put you into a better position now?
Yeah, I think I wish I had... So we organised ourselves into major incident mode quite quickly, and that was really well done, because we kind of know how to do that. What I wish we'd done is be a bit more... I wish I'd been a bit pushier about having a sort of a programme with timelines to show people this is a point when we think, based on the numbers London's telling us, that we think we'll run out of beds. And I wish we'd done that more clearly, because I think it would have helped people think through a bit earlier, oh my God, I really can't continue nursing or providing medical cover on the basis that I've been doing in the past. And I think I could see that. A few weeks ago, and I and another couple of chief execs had this conversation, and we went, oh my God, which is kind of how we ended up with the kind of London numbers, because it was, someone called it and said we've got, we're absolutely going to run out of space in London. But I wish in my organisation I had sort of taken some of those numbers and planned them, because it just would have given people a bit of a head start, so that they would realise that we're clearing out the hospitals and making them a bit quieter now, because actually this thing is very contagious, and suddenly when one person has it, several people have it, and then when several people have it, lots of other people have it, and the numbers do rise pretty much exponentially. And so many people will be thinking there's a calm before a storm, probably listening to this. They might be in that quiet period. I've had my quiet period. It was earlier last weekend and earlier this week, and we're now in our numbers are kind of sort of look a bit vertical. And so in my hospitals, we've used up our ITU capacity. We've gone to what we call surge, which was in using recovery areas, and now we're into theatres. And then at some point towards the end of next week, I think we will end up being having to use the Nightingale Hospital. So not all hospitals will be in the same position, but most of us in London will be it'll be something like that. So I think I wish I had used my planning and modelling skills to just really clearly and simply articulate what was coming at us and what I could see was coming at us, because I think it would have helped unlock some of those conversations. I accept that they might have made people a bit more anxious, but it is people need to talk about it. I mean, the other thing is, a lot of this is about clinical leadership and hearts and minds and people stepping up, and where they step up and where they understand what's coming up, they can have those conversations with their teams and reassure them. I've seen our medical teams completely reorganise themselves. Actually, I wish they'd done that a week before. So in both hospitals, the main ones, our medical teams now look like firms. So for anybody listening to this who's my age, which is 51, I remember joining the NHS and doctors organised themselves in firms. So you'd have a senior consultant and a registrar, a couple of registrars and some house officers, and they'd all work as a really clear team, and they all knew who was in charge, and they were kind of really tight. And we've kind of gone back to that now, and they all really like it. The seniors like it because they've got a clear sense of team rather than having different people floating in and out. The juniors like it because they're learning really good medicine and they've got a leader and they've got a structure, and they've organised themselves so fantastically well. And so that's something that I would get people to talk to their medical directors about how they get their rotas sorted out really quickly. That's a good thing to do, and then talking to the nurses about getting comfortable with a much skinnier set of rotas. That's the best way of describing it, where you'll be working with people who are less qualified than you across wider ranges of patients in a much more protocolised way. So the other thing that I've learned is that actually, in order for the UK response to Covid-19 to work, we need to provide ventilated care to larger groups of patients in wards, like Nightingale wards, like in the Excel Centre. That's why it's called Project Nightingale, because it's going to be lots and lots of Nightingale wards where you can see lots of patients at once. And I think we didn't realise that early enough. That's been a kind of, that we've known that for about 2 weeks, that we don't have enough staff in the UK unless we nurse very differently.
Thank you, Caroline. That's been absolutely fascinating. Thank you so much for talking through all of that with us.
Well, I hope it doesn't unnerve people. I suppose the big thing, at the end of the day, this is the challenge of our lifetime, isn't it? And it's the thing that we'll all look back in 20, 30 years and think, oh my God, what was I doing? And did I do enough? And of course, I'm just seeing every day people just doing so much and stepping up and stepping beyond. And I'm sure lots of people listening to this will that'll resonate with them. And I think our profession has got loads to offer. I think we really can step up, both in the day-to-day stuff that we do, but also by taking on additional duties and just being brave and stepping into other roles because they're there and they need doing. And I suppose the other thing I'd just say is remember, ultimately our business is all about people. It's all about relationships and how you are. And if you've got one eye on today and tomorrow and another eye on kind of recovery, because we will recover, and this time next year the NHS will feel very different, and we must keep the good stuff, keep the energy, keep the new ways of working, keep the slicker systems, keep the fact that hardly anyone really needs to come to hospital for an outpatient. Lots of that stuff can be done on the phone. All these new ways of working, then actually the NHS could come out of it stronger. And who hasn't been moved by the level of support from the public about this stuff? We are Britain's national treasure.
Thank you, Caroline. Thank you for your time. To support our members and colleagues, all COVID-19 related briefings, blogs and news articles are openly available on our website, hfma.org.uk. There is no need to be a member to access these, so please tell your colleagues. We hope to provide regular podcasts throughout the pandemic covering a range of areas. If there is a particular aspect that you would like to hear about, please let us know. The HFMA will also be providing more webinars on a range of topics to both support the immediate needs of the NHS finance community and future CPD requirements. It is important that we support each other and keep our network strong. We will do all that we can at the HFMA to enable this. If you have any suggestions of other support that we can provide, please email us at policy@hfma.org.uk. Thank you for listening to HFMA Talk. Don't forget to subscribe to this podcast to keep up to date with new episodes.